Hello students, we'll discuss a clinical case. Just see what is this. See that in the little finger there is a swelling. It is tense, well localized, probably it is smooth, and actually on examination, smooth, tensely cystic, firm, but the Page's test is positive. You know Page's test how to do? Fix the swelling like this, indent over the summit, you will get yielding sensation. You can feel the fluid push. That is the test for fluctuation in a small swelling. In a large swelling, you have to fix the swelling. Two finger you place, elevate, do it in the perpendicular to each other. Fluctuation test. You can go through my fluctuation test YouTube lecture, which I have done earlier. I'll give the detail about the video of the fluctuation test I have shown actually. You can go through my earlier YouTube lectures. And you can see that swelling here. And that is the swelling. And this is implantation dermoid. All of you know that implantation dermoid occurs, acquired dermoid. It usually occurs in the palm and sole, where a fine small prick injuries like needle prick, thorn prick, yellow makes the epidermis to bury under the dermis into the deeper plane, subcutaneous plane, which evokes some reaction from the cuirassic capsule and putty-like material, which is not translucent but soft and often firm, and well localized swelling which is adherent to the skin, So that's a typical of the implantation dermoid, common in the fingers, common in the toes and plantar aspect of the foot. So because of the trauma, minor trauma it occurs actually. It's an acquired condition. This is not congenital, unlike cicatrician dermoid, which is congenital. The skin is not free and maybe swelling is mobile, bone is not involved because it is the subcutaneous. It's a tensely cystic swelling. So treatment here is excision. You can take an X-ray. If you are worried about FNS, you can do a MRI also. But clinical diagnosis is sufficient in this patient. But if you got doubt, you can do all these images and FNAC. And differential hemangioma, lipoma, and neurofibroma. So after excision, under local, you can do excision. When you do a local anesthesia for little finger, never use dilocan with the adrenaline because digital vessels are end vessels. Digital will go for gangrene. So lidocaine without adrenaline is very important. We should use for the fingers and toes. So inject that and make a vertical incision and excise it and send it for histopathology. Place skin sutures using proline, 3-0 cutting needle proline, polypropylene. Remove it after 7 to 10 days. That is sufficient. That is the implantation dermoid. Very commonly asked short note. It's a short case. It will be kept in the exam. That also you have to remember. And so different dermoids are sequestration, tubulodermoid, ceratomatous dermoid, implantation dermoid. I can always go through my SRB manual of surgery swelling chapter, which gives the details about all these things. All these things are short notes: sequestration dermoid, tubulodermoid, ceratomatous dermoid, implantation dermoid. I have already told. You can go through my service manual of surgery. You can go through my clinical methods in surgery also. Swelling exam also gives the detail about these implantation dermoid, different types of, with the photos of course. So you can go through my manual of surgery and clinical method surgery for detail, please. And answer the MCQ students. Submental dermoid is A, B, C, D. Find out the right answer, put it in the comment box, acknowledge your answer, put the right answer later. Answer another MCQ. Thyroglossal cyst is what type of dermoid, what type of type it is. So find out the right answer. I'll put the right answer in the comment box and I appreciate your answer also. So students, quotation of the day is, people are curious about the stories of the book rather than chapters of the book. So there is the difference. Stories, just listening. Chapters, in depth, you are going through and listening. There is the difference. So chapters are more important than the stories. So you go anything you go through, anything you face, go in depth. Anything you do, go in depth, not superficial. It's exact meaning of this beautiful quotation. That is, people are curious about stories of the book rather than chapters of the book. And students, please subscribe my YouTube channel, SR Surgical Insight, and press the bell, share with your friends and colleagues, update your surgical knowledge day-to-day basis for instruments, specimens, clinical cases, operative surgery briefly, techniques, images, and so on. Please subscribe my YouTube channel, share with your friends. And also have my SRB's manual of surgery, which covers everything about surgery, oxy, general surgery, thyroid, breast, peripheral artery disease, varicose vein, reconstruction, transplantation, and GA surgery fully, urology, neurosurgery, cardiothoracic, adjuvant therapy, anesthesia, and briefly instrument operated surgery also. And so it covers everything as far as oxy is considered, and it gives a lot of photos and illustration with the proper management policies, with the principles, with the staging for carcinomas, with beautiful quotations in the footnote. It will be very, very helpful for you to understand surgery for your facing the exam, both for UGs and PGs. To have my SRB manual surgery, also have my clinical methods in surgery in current edition, which gives the exact method of examination, general surgery, hernia, hydrocele, breast, thyroid, arthritis, varicose vein, everything. And briefly urology, specialties, and briefly orthopedic also, and with the differential diagnosis in the tabular form. So it's very, but no management. With the videos of all examinations like hernia, hydrocele, thyroid, breast, swelling, ulcer, arthritis, varicose vein, and so on. It's very, very useful for you to face the exam, to how to examine the patient in a day-to-day, every present day case. It will be very useful. And also, my digital lectures through JP Publishers covers everything about through Oxy. 220 lectures are there. Full general surgery, briefly specialty, operative surgery, instrument specimen, and clinical examination covers purchase for 1 year. Before facing the exam, if you go through it, we can learn surgery entire thing through digital lectures. Please purchase for 1 year. Have my SRB manual surgery, have my clinical method surgery, and subscribe freely for my SRB Surgical Insight YouTube channel to upgrade your surgical knowledge on day-to-day basis. So students, I hope you understood this lecture very well. Thank you so much.